Hi, so the big news today, this week, is that I finally got braces. Anyone who meets me or sees me can see that I have this very prominent gap between my two front teeth. It's about 9 millimeters, 1 centimeter, without the bonding in place. And it's the first thing people notice about me often, and I don't like it. I would like it to be fixed, basically. And in addition to these big gaps, I have a lot of other orthodontic issues that over time will cause me great pain and great expense if not dealt with ASAP. So I finally managed to figure out how to go about getting braces, and I did. And I have not been happier in a while. So, in addition to the gaps, I have like this overjet that goes about a centimeter. And so, in a year's time, I'm gonna have my lower jaw extended to meet the upper jaw, basically, in a procedure called a mandibular advancement. I don't know if I pronounced that right, but that'll happen in a year. I'll have my jaw hacked in two, moved forward, and screwed back together again, which I'm kind of excited about because I've never had any kind of surgery before in my life. So that'll be fun to go to a hospital. But I will have the braces on for 2 years, and then I'll have a retainer on for a time, and then I'll look different, hopefully, and my teeth will function better. So I'm looking forward to that. In the meantime, I'm kind of getting used to the orthodontic care that I need to do. Mostly braces have a tendency to need to be flossed more frequently than regular teeth. So I use these special Oral-B things that are made for braces where you can easily slide in and out. Some people can just use regular floss, but I find I'm unable to do that at this point. And a lot of people say they need to put the orthodontic wax on. I haven't yet had to do that. I haven't had any cutting or anything. It's actually quite comfortable. I have, however, experienced a bit of pain with the shifting of teeth, especially in the first few days. So I just took a few Tylenols and it was all good. But it's really exciting. It's something new to put my mind on, something to look forward to, and it's something, again, I've always wanted braces. I remember as a child, this was always something that made me really stand out. And going through foster care, for example, I would open my mouth and people could tell, just looking at my mouth, that I did not come from a good home or that I did not have parents or caregivers able or willing to pay for the orthodontic work I needed. And as an adult, to some extent, this was always a reminder of that. And I recall, for example, a professor in university, I think it was Jim Struthers, the Canadian Studies prof at Trent University. He said, if you had braces when you were a kid in Canada, you were middle class. That was his barometer of what middle class was, and certainly I wasn't. So it would have been good to get it when I was younger, because then I wouldn't have needed the surgery, possibly. I could have just sort of grown in with the braces, but it didn't happen, and that's unfortunate. But now it has happened, and that's good. It's better now, better late than never. So in a sense, this is cosmetic, and it'll make me look hopefully better. Certainly it will improve my physical health in that my teeth will be better aligned and better preserved for time. But for me, there's also a psychological aspect of it that has certainly not escaped my mind. Like just seeing this visible self-improvement over time that I've wanted for many years, and perhaps taking care of myself in a way that, in a very specific way that my caregivers who were supposed to didn't, but I'm able to. So that feels good. And I don't know what else to say about it except I'm happy and I'm looking forward to a new smile, as they always say. That's all I need to say.